Good morning, all. Am I audible to Dr. Ranganathan? Am I audible? Please unmute yourself, Ranganathan.
Yeah, you are audible, Gopal.
Okay, good morning, all.
Good morning.
Hope you all are well. Hope you all are well. Today's session is about common sports injuries and their prevention. It will be presented by Dr. Ranganathan M. So I would request Dr. Ranganathan M to start the session. Please, Dr. Ranganathan.
Yeah, thank you. Thank you, Gopal. I'll just start my sharing.
Yeah.
Okay, is it visible? And am I audible?
Yes, Ranganathan, it is visible.
Yeah. All right, thank you.
Please start.
So, a quick introduction about myself. I am Ranganathan. I'm a sports physiotherapist in SAI NSSC Bangalore. All right, today we're going to discuss about the topic called common sports injury and its prevention. So I'm trying to keep it very simple so that we all can get better idea about this, what we are going to discuss about it. Injury prevention is a very critical term. So we should say it is an injury reduction. So how do we reduce the injury? So there are some amount of things we should follow it. So we'll go through one by one. There are a lot of sports injuries can be done in sports, while playing. So what is sports injury? Sports injury is nothing but during an athletic activity, that is our sport. When we are playing a sport, our body is not allowing to function to its full, and it is not allowing the body to heal. When there is an injury happening, the injury is not allowing the body to function full, and not healing is called sports injury. It's a regular common injury, and sports, when it is attached, it's called sports injury. So generally what will happen to the injury? The injury can happen to the musculoskeletal system, which is muscles and bones, right? So majorly the muscles, tendons, the cartilage, which is the this pasting structure on top of the bones, and these things can go into an injury when there is an injury happening, and often it results pain, swelling. Like example, when we have an ankle twist, there will be a huge amount of swelling, or when we have a knee twist, there will be huge amount of swelling and tenderness. Even when you touch, there will be a very high amount of pain and inability to use. When a player get injured himself, for example, again an ankle twist, so he can't walk again. So inability to use that particular part, it is, and when we do any weight on it, like weight bearing activity on the affected area, it will be painful. So sports injury is a form of stress placed on the body during the athletic activity that prevents from functioning to the full, right? So what are the common sports injury? So there are so many injuries. So we collectively have few injuries together here. So one is traumatic or collision injuries, which I'll show you what it is. The collision injury is nothing but when the two players, when they're going for 50-50 ball, they collide each other. And the trauma is nothing but, when you fall on the ground. So we resulted in the traumatic injuries. And the very common is the ligament sprain and tears. Even ligament can go into tear. So ligament sprain are very, very common in sports, especially the lateral ankle sprain, which we say. And other form. And yeah. Kindly mute yourself, sir. And there are muscle tears. Muscle.
phone dead ho gaya ji, main charge ਸਵੇਰੇ ਲਾ ਕੇ ਆਉਂਗਾ, ਕੁਝ ਮੈਂ ਜਾਣਾ ਸੀਗਾ ਤਾਂ ਕਰਕੇ.
Okay, I'm gonna mute.
ਮੈਂ ਹੁਣ ਜਾ ਰਿਹਾ ਸੀਗਾ.
Dr. Ranganathan, please unmute yourself.
And subluxations. Subluxation.
Dr. Ranganathan, please unmute. I would request all the participants, please mute yourself. Okay, Dr.
Yeah,
Ranganathan, please
thank you.
start. Please start. Please
Yes,
start.
yes, thank you.
Okay.
Yeah, there is a difference between dislocations and subluxations. Coming away from the sitting position, where in subluxation it won't come out, but it is still the out of the position. It's called subluxation. It is equally painful. And of course, fractures and cramps. Cramps are also one of the major common sports injuries. So these are the like a few examples for traumatic or collisions where the football player bumps into each other, or when we play. I'm just giving you few reference. It is common in most of the sports, even boxing, taekwondo. The collision injury can be higher. There'll be a small amount of and muscle contusion and tears. So this is very common in a contact sports. Play like volleyball, when we go for an attack and when you defend, it can also cause a lot of contusion in your joint as well, not just the muscles, even in the joint. And these are some example of dislocations and subluxations, where there are most common in ankle and shoulder. Chances of dislocation is more. And fractures. So fractures again plays a major role in a contact sport. So these are the common types of injuries. Cramps, what we say, it also can have cramp, also considered as a common injury in sport. So what are the importance to prevent these injuries? So injury prevention is very important, because if the player is getting injured again and again, he can't achieve his training goals. He can't perform well. And if he can't perform well, if he can't achieve his goals, then the regular physical health also in trouble. So we need to have a complex activity, performing complex activities without preparation. For example, like warm up, it can hurt our body. Okay. So injuries can happen in sports, during sports, or not playing also. Like when we play a recreational sport, for example. So those time also can happen. So we divided into two basic categories, which is non-consequential, where when you play a non-sporting activity, when the injury happens, that is non-consequential. Prevented, but the risk of injuries can be reduced. It's very difficult to prevent injury. Whenever the athlete or a player is training, definitely when the training hours are increasing, when their body condition is not acclimatized, then there will be a chances of injury. So it is very difficult to prevent an injury. So we can reduce the injury level. So we need to find ways to reduce the injury. For example, if we have to reduce the muscle soreness, so we can keep progressively load the muscle. So the cross section of the muscle fibers increases, the absorption quality increases, so that the muscle is ready to take up the load which we are giving. So basically the tissues are more plastic in nature. So we need to know how much stress, how much pressure, how much weight can be given on that muscle or the ligament, so that we can prevent the injuries. So we saw the common injury types like collision, fracture, cramps. So now we see the common cause for the sports injuries. So what can be the common causes? Like direct trauma, overuse, which is very, very common because the trainer keeps training without giving adequate recovery, rest. Then it becomes an overuse. And while playing, sudden stops and twists. improper equipment and increased or new activity, especially this during pandemic time, when the athletes are gone home, when they come back, we don't know their physical abilities. When we start doing the training, then the chances of injuries are more. And overtraining, the athlete keep training again and again. And this is very, very important, which is poor warm-up. Uh, sometimes the athletes, many times the athletes doesn't warm up adequately, so it can lead to an injury. And impact on hard surfaces. So nowadays we see a lot of shin splints when the athlete training starts training after a long time. The improper warm up or inadequate warm up and training on the hard surfaces lead to shin splints, knee pain, even back pain as well, right? So unilateral movements, most of the sports are unilateral, one-sided. We when we run, we land mostly on one side. One leg takes more load, then the other leg takes more load. So these are also one of the causes can create a sports injury. And poor techniques, lifting, poor techniques, improper way of lifting. So all those things can create a sports injury. Nutrition plays a major role. If that is a separate topic, we can discuss about it. Nutrition plays a major role in recovery for the athlete. And hydration. So drinking water is very, very important. So there is a guidelines for the daily intake of fluid as well. So if the player or the athlete fails to do so, then it leads to an injury. Okay. So there are few pictorial explanations for this. Direct trauma, which is very common in a contact sport. So this is a common cause for the sports injury. And the overuse, like I discussed, overuse. So stress fractures can happen because of overuse, and it can lead to failed in participation of sport. So these all the overused injuries. And sudden stops and twists. When we play, for example, basketball, when we run and the ball is moved to the other court, then we have to stop suddenly and then move. If the athlete doesn't have the ability to change the position, which is the agility training, or the balance, what we say is proprioception, inadequate to maintain the joint in the space. So those things can lead to an injury. And improper equipment. Not fitting a good shoes, changing shoes with the athlete when we don't have shoes or even socks in that person. So improper equipment can be the major cause for the sports injuries. Like I said, unilateral movement. Unilateral movement also one of the cause for the injuries, because most of the time, if we lack balance, agility, the proprioception, then the chances of injury is more on when we land on one side, right? Poor techniques, lifting technique. If we don't follow a proper lifting technique, good that we have the SNC experts. So we should take help from them to know how to lift properly. If the lift doesn't happen properly, then that also leads to an injury, right? Like I said, the nutrition, we should have a basic diet, and we have nutritionist. So we should take the help from the nutritionist and take the diet plan from them. Have specific diet program for the specific sport so that we can prevent the injuries. Hydration, fluid intake is very, very important. So generally we ask the athlete, what is the color of your urine? So if they say the color of the urine is yellow, then they may be dehydrating. So it is not that, when we feel thirsty, we should drink water. We should adequately drink water. We have to keep ourselves hydrated during the training time and during the sport. So there is an USA guidelines also for the hydration. And there is an, they say you have to take some 500 ml of water before bedtime. And when you wake up, you need to have 500 ml of water. During the training time, you can have between 200 to 300 ml of water. So many times we weigh ourselves before training. So, and weigh before and after, meaning we check our weight before and after the training, and we'll see how much weight we lost. So it can be our fluid loss. So we need to replace the water. We don't have to take just the water. We can use, juice, milk throughout the day. We can keep ourselves hydrated. Right. So what is the role of physiotherapist in preventing the injuries? Physiotherapist plays a major role in prevention of injury recurrence, and we play a major role in early return to the sport. Inadequate recovery will not help the athlete to go to the participation. Return to sport will be a major issue for them. So we do have a musculoskeletal screening, like yesterday when we had Dr. Rupali's pre-participation screening. So in that we have something called a musculoskeletal screening part in PPE, pre-participation examination evaluation. So in that we need to know, physiotherapist will do a clear examination of the musculoskeletal screening. Along with the strength and conditioning experts like FMS, functional movement screening, and other sports scientists' help, we can play a major role in preventing the injuries. Okay. So what are pre-participation evaluation? Like yesterday, doctor has explained very well about it, and we should skip this. So what are the aims? So aim is to ensure the optimal medical health, whether the player is fit to play, and to prevent injuries, and whether they are under any medication, nowadays they are vaccinated or not, develop a professional relationship with athlete, and educate the athlete about the importance of injury prevention and the field participation, and the readiness to participate in the sport. And unfortunately, it can the pre-participation evaluation can help us to prevent sudden death. Most of the time we see games like football, the player suddenly collapses on the field and then dies. It could be because of the initial ailments that he was suffering from, or the sudden increase in the the blood pressure or the heart rate. So the pre-participation examination conducted by the doctor can help us to find out this early symptoms. Then we can prevent all these things. Right. So generally, MSK is nothing but musculoskeletal screening, which is done by the physiotherapist or doctors. So we do a functional screening and the general screening to check the range of motion of the joint, to check the muscle length palpation. We check the balance test. Break test is nothing but to check strength. And functional wise, we ask them to do a squat, lunges. If the player or the athlete is ability to do those things, then the chances of injury can be prevented. These are the few examples what we will do in musculoskeletal screening. So we check the, for example, joint wise, we check knee, hip, shoulder, we check all the range of motions and things like that. Even for the lower back, we have the special test. So we use that to check whether they have a full range in the lumbar spine, or if there is any pathology in it. And stability and strength, we do check with the balance test and everything. Okay, these are general screening. We can skip this part here. So what are the risk factors to develop the sports injury? There are two different factors. One is internal factor and an external factor. Internal factor can be again divided into two, like modifiable and non-modifiable, and external factors are many. So we'll discuss about one by one. So internal factors can be age, gender, body composition, age, younger age, just excuse me. Okay, age. So we have something called little league pain. When the athlete is not matured enough, and when he's doing exercises which is beyond his capacity and potential, that can lead to these injuries. And gender, generally, there are some specific injuries which is more common in women, which is more common in men. So we should know about it. And body composition. So a good muscle strength and good muscle endurance can help us to prevent the injuries. So body composition also plays a major role. Prevention of previous injuries, whether the athlete has any previous injuries. So that previous injuries, if it is not recovered completely, that can lead to the injuries again and again. For example, ankle again. If the ankle twist, once it happened, if we don't recover or treat, rehabilitate properly, the athlete has their chances of recurring the injury again and again. It may lead to a different conditions, and then it reduces his participation in the game. So anatomy is like sometimes we have people have the pigeon chest, extra carrying angle where the angle of elbow is more outward. So when they do exercises, sometimes that may lead to injuries. And skill level, which is very important thing again. And the psychological factors play a major role. Okay, so these are the internal factors which can lead to a injury. And exposure to the external factors. We'll discuss this again in the other slides. So factors in prevention of sports injuries, like we discussed, pre-participation evaluation. So what we will do in pre-season, we'll check the musculoskeletal evaluation. For example, here I've given few examples, like we check if it is neck, we'll do the movements. For shoulder, we'll check the range of motion. For every joint, we have a musculoskeletal screening. So every athlete has to go through the screening. That can help to prevent the injuries. Warm up. Again, everybody knows how important is warm up. Warm up is nothing but the ability of increasing the core temperature in the body so that it can help the injuries to prevent. So we have a general warm up, which can be followed by everyone, and specific warm up towards the sport. Sorry. So cool down again plays a major role. In warm up, for example, if we hold the stretch for 5 seconds to 8 seconds, in cool down, we need to hold it for longer time, like 15 seconds to 20 seconds, and we can repeat again if it is necessary. So these are the few examples what we can do in cool down routine. Stretching. Stretching plays a major role in preventing the injuries. The definition of the flexibility itself is ability to reduce the injuries. So we have to emphasize more about this to our athletes, making sure that they are doing the adequate stretch pre and post exercises. And we have different types of stretching. We have static stretching, where we hold at one position for 15 to 20 seconds. And we have a ballistic stretching, is nothing but the bounding stretches, bouncing stretches, what we can say. That is also help us to activate the muscle quickly. And PNF stretching, it can be rather done by the fellow athlete, or the coaches can guide them, or the physios can guide them how to do that. There's a proper neuromuscular facilitation stretch. And conditioning. So conditioning plays a major role in preventing the injuries. So there's muscle strength, endurance, flexibility, balance, and very importantly, the training principle. Muscle strength, when we have a good amount of muscle strength, the body mechanics is good, the weight distribution is good, and ability to do the action is good. So we can easily prevent the injuries. So it has muscle strength plays a major role. So muscle strength and endurance. Endurance is nothing but ability to work for a long period of time. So when a muscle works again and again, it loses its, it goes into a fatigue stage. So how to avoid stage? We need to work fatigue. We need to work on the muscular endurance. So when we work on the muscular endurance, the muscle's capacity to work for the longer period increases. Okay, this is how we can work on the injury reduction. Flexibility, again, like I said, flexibility plays an important role. When we have a good flexibility, the chances of injury is very, very less. This women, grandma is from Coimbatore, she is 90 plus. So she practices yoga every day. And balance. So balance is or proprioception plays a major role in prevention of twisting kind of injuries. A good balance will help us to maintain our body's position in space. So chances of recurrence of the injury also can be reduced. Environmental factors. So when we play in a hot climate or the cold climate, we make sure that we do a good amount of, if it is cold climate, we need to give a little more emphasis on the warm up for a long time. If it is hot climate, make sure that we are training in a particular time so that we don't expose to the sun for very long time, and we can avoid fatigue or other types of problems. And education program to the athletes, very important. They should know how to recover the body, how to take care of themselves, how much water they should take, like the hydration part, and what are the eating habits, like proper eating nutritional food. So we need to educate them even about the basic body movements. They should learn about the anatomical terms, if not completely, but at least
Good
few
evening.
movement
I have the
technological terms. All right. And protective equipment. Protective equipment plays a major
Hello.
and taping and bracing when the long distance jumper, when he's going for the jump day. So to prevent the injuries, he or she can tape or brace with the help of physio, so that we can really reduce the injury happening, right? So appropriate training methods. So we always have to follow a proper protocol. Like we have a training principles like specificity and individualization program and progressive overload. We can't just overload the athlete, So we need to progressively overload, which comes from the training frequency, interval, and the time. So everything involves in an appropriate training method. Rest and recovery, yes, of course, everybody do agree with this. Rest and recovery plays a major role in the form of hydrotherapy, icing, nowadays foam rollers, massage guns, steam and sauna can be helpful. The coaches can decide the athlete's recovery day on after the hard session. They can go to the swimming pool. They don't have to swim, but they can just walk inside the water for a few minutes. So that will be very helpful for them to recover for the next day's program. And muscle soreness has to be attended immediately. Like muscle soreness is nothing but when the hard session happens, next day the athlete develops pain in the muscle, which is a good pain sometimes we say. And the muscle soreness can be reduced by intensity activities or icing that can help. And appropriate equipment. Good equipment will help us to reduce the injuries. And this is the major factor, the psychological factor. I hope the psychologist will talk more about it in the coming sessions or the previous sessions. And the training in the extreme conditions. So when we go for the high altitude training, we should train accordingly. And when we are training on the very sunny day, we make sure that we drink adequate water to keep ourselves hydrated. And when we are training like cross country, we should make sure injuries, right? All right. So this is my end of the session, and thank you all for listening. And we can have a few take-home messages. Always stay conditioned. Stay conditioning is nothing but make sure you have a good amount of strength and flexibility, and don't forget to hydrate yourself. So hydration again plays a major role, and make time for rest. So rest is very important, and warm up and stretch, and use recommended safety equipments. Like if there is something which is recommended, we should go with those equipments. We can't have the standby or substantial equipments where we use that and then we get into an injuries, and play safe, right, and follow the rules in the game. So sometimes when we don't follow the rules, then unnecessary injuries can happen. Like an example, football, we can't the ball, we don't have to go for the player to attack, right? So the few rules can be followed so we can stay safe, right? Thank you. Gopalji, I'm done with the
Okay.
session.
Thank you, Dr. Ranganathan, for this
Is
wonderful
any
session.
questions?
So I would request all the participants, if they have any questions, so please may ask. If not, then we will close the session regarding this common sports injury. If anyone has any question, please unmute yourself and please ask your question.
I think this video will be available
Available
later,
on YouTube or YouTube.
Yeah, on YouTube.
Yes.
So we can always go through it, and if you have any doubts, the concerned physiotherapist, you can always consult a physiotherapist in the centers. So all the physiotherapists are well versed about the common injury protocols and preventions. So definitely, if you can't, you don't have to reach me, but I'm always happy that if you can reach me. And if you can't reach me, then due to the language barrier, I don't speak much of Hindi sometimes. Yeah, so you can always consult your physios and the medical doctors. They'll be very helpful for you to understand better, and we can work towards so that we can prevent a lot of injuries.
Okay. Thank you, Dr. Ranganathan, as well as thank you all the participants for attending this session. So now we are closing this session, and now we will meet on 6th. We have a sports injury related session of weightlifting. So thank you all for attending this session.
Thank you, sir.